With changes in the weather may come a change in the sound of your voice. Abnormal changes in the voice are called hoarseness. A hoarse voice may sound raspy, breathy, or strained. While the most common cause is acute laryngitis, Rebecca Hill, speech-language pathologist at Lake, Ear, Nose, and Throat, explains what a hoarse voice could mean and how it is treated.
The patient usually will go to an ENT because they're hoarse. That's almost always the issue. Their voice is hoarse and they don't know what's going on, and it's become such an issue that they don't want to ignore it. Technology has provided us with an opportunity to see your voice box much clearer and sharper, and we can actually see the vocal folds oscillate. And when they oscillate, which means they flip back and forth, that's when a lot of times you are able to visualize lesions that you may not see when the physician is using the traditional flexible endoscope that goes through the patient's nose. When a patient is referred to have a video stroboscopy evaluation, they'll come into the office and we'll take a short, brief history of what their issues have been and also what the physician found prior to the physician referring the patient to come get this specialized evaluation done. I'll place a rigid endoscope with a very bright light and a very high magnification lens on the tip of this scope and shine the light in the back of the patient's throat. And that's all there is to it. It doesn't go down your throat, it's just in the back of your mouth so that we can see your voice box. The actual procedure only takes about 2 minutes, but you need to plan to be here for about an hour to get through the whole history and the full examination. Depending on the diagnosis, we will provide therapy to improve the patient's quality of voice.
For more information on this story, as well as links to the specialist at Lake, Ear, Nose, Throat, and Facial Plastic Surgery, please click on the Sounding Hoarse story link on our homepage, yourhometownhealth.com.